Mataji, please tell us in terms of what is your service and how long you've been doing it, what do you like about it, and what are the challenges that you face in this important service of helping people that you do?
What I really like about it is how wonderfully people can turn their lives around. With therapy, it's a life transforming experience. When you open your heart to a therapist, it's really like you're gifting a very, very deep, sacred place in your heart to someone.
That's true.
And so you have to choose your therapist with care, of course. So I feel very, very privileged that people trust me with their innermost feelings. I consider it a very sacred gift, and I try my level best by mercy of Guru and Krishna to take them past those emotional blocks, to take them past that trauma or that hurt or that pain or whatever they've experienced that's causing them to stop being that loving, compassionate, caring, joyful devotee that Lord Chaitanya wants us to be. So I really want everybody to become ecstatic in devotional service. Yeah. I want each one of us to be so joyful that the rest of the world looks around and says, what's with these Hare Krishnas? What makes them so happy and joyful?
Right.
And
So
that's
happiness in individuals and family is actually what creates happiness in the movement. That's what
you
you're
said
saying.
it. Yes. Yes,
Right.
yes,
Very nice.
That's what I would like to do to help people get past that.
Okay. What are your challenges? What do you find is difficult? What is hard in your service? What is hard?
The hardest part is getting people to admit they have problems
Wow.
and to come. Because they say that when you want to move from 0 to 10, the hardest step is 0 to 1.
It's true.
So there's a huge, huge, huge block right there. People don't, because of the stigma. People think coming to a psychotherapist or a psychologist or a counselor means you're loony, And I say, you know what? Therapy is for sane people. You want to get better. It's for intelligent people who want to have a better quality of life, who want to really experience the fullness of joy of bhakti. We're meant to be joyful. To be joyful is to be normal. So if you're not joyful in Krishna consciousness, if something is blocking us, isn't it the most common sense thing to approach somebody who can help you with that, get past that, and become a joyful person in Krishna consciousness? We're meant to be joyful. So to me, the hardest part is the stigma and the mental blocks that people have that prevents them from coming to see me. It breaks my heart to see how little it would take, to just move from 0 to 1, and then you're zoom 1 to 10.
So what you're saying is it's very important when people have some emotional blocks or some kind of psychological problems, it's best not to suppress it, but rather address it. Try to cure it instead of let it grow and make them sicker and sicker.
Absolutely. Because one dysfunctional person can create 8 to 10 dysfunctional relationships around them and make other people sick. Because then you spread that negative energy, and it's like a ripple effect. It goes out, and it's so sad.
Right.
We don't have to be like that. We can be joyful.
Yes.
By Krishna's mercy and help. So that's what we are here for, especially I believe that this is a calling for me. I was actually a medical doctor. I was a pediatrician and a neonatologist. I'm an MD in that. And I practiced for 8-10 years as a pediatrician. And it's the trauma that children experience due to dysfunctional family relationships that made me move to the mental health field, because I realized that the heart pain is not something that's visible. Like if I have a fracture, you can see it. I say, Sri Radha, I got a fracture. But when my heart is hurting, nobody can see it.
Subtle.
It's very subtle. But the pain is tremendous, and it affects everybody in the family, especially parents. When parents are quarreling and the children are so traumatized. So my passion is to help parents get better so that they can have a happy marriage and a happy family life, and their children can grow up healthy and strong, because when family breaks up, it's devastating for the children. So I did my PhD in marriage and family therapy for this reason. It's I could see the trauma children are experiencing, and I wanted to prevent that. I wanted couples to understand that, their role as parents is so important for that child's life.
Yeah.